Hi, my name is Steve Stump. I'm the principal agent with U.S. Benefit Advisors, and today I want to talk a little bit about emergency care and how you should think about getting your emergency care taken care of. Now, emergency care doesn't necessarily equate to emergency room visit. You obviously are the one that's going to decide whether emergency care is important for you. It could be something that happens over the weekend where you simply come down with a cold and congestion and you got an early morning Monday flight. Your doctor's obviously not open, and so you've got an emergency care situation because you don't want to have a miserable flight on Monday morning. On the other extreme, when that bone shouldn't be sticking out of the skin, obviously that's an emergency situation. So each situation is unique in the sense that they may require an emergency room visit or not, but I want to talk to you about those ones that may not necessarily require an emergency room visit and how you should think about them. Behind me, I've got prioritized a list that you should be thinking about when considering emergency care. Teledoc being at the very top of that list. Now, in a recent study, over 70% of people said that they would use Teledoc visits. However, only about 30% are actually using Teledoc visits. This is a great opportunity for you to take advantage of a Teledoc visit during an emergency care situation where one of the others are not required, because it allows you to get very quick access to a doctor, typically on your mobile phone or your computer, and you can get your symptoms taken care of, especially in that case where it may be over the weekend and you've got a busy week ahead. The other one is obviously doctor visits. Oh, and let me say, Teledoc visits are typically free with insurance plans. If they're not, you need to find a new insurance plan. Obviously, you can go see your regular care physician, your doctor, and schedule a visit. Sometimes these visits are very difficult to get in, especially if you've got a popular doctor. Again, those Teledoc visits might be an alternative for you. Of course, you're going to pay copay and you're going to have coinsurance potentially for that visit. So think about that in terms of cost. Your third option is an urgent care facility. Now, this is very different than an emergency room in the hospital, and the last option that I'll talk about is a freestanding emergency room. Make sure that the location is considered an urgent care facility. Otherwise, if it's a freestanding ER, your copays are going to be vastly different. Your copay with a freestanding ER is going to be your ER copay, whereas urgent care will be more similar to a copay you might have with your doctor. So these are convenient places to go, but make sure it's an urgent care facility and not considered an ER. The fourth option is, of course, a hospital ER. Now, these are obviously convenient. We're all very familiar, or maybe familiar with going into these ERs. Please make sure your hospital is in network, but keep in mind, one of the biggest problems patients have is the physicians inside the ER are not in network. And so this results in a surprise billing where they go to the hospital, which is in network, but then they get an out-of-network bill from a physician or a doctor that attended to you inside the ER. This is unfortunate, and if your insurance company helps you with these surprise bills, you should escalate to them. If not, you should look for a new insurance company. The last and probably the most expensive is what's called a freestanding or standalone ER. These are becoming very popular, especially as various investment funds are beginning to invest in these platforms. These typically are at residential corners, and they're not associated with the hospital. They may be near one, but they're not associated with one. There was an interesting study done by ACEP now. They're basically the voice for emergency physicians, and they wanted to understand why freestanding emergency rooms are having such a difficult time getting in network with carriers. So here's the survey that they did. They asked freestanding ERs what their success has been getting inside network with the big carriers. 64% were not able to get a contract with a carrier, and here's the reasons why. 45% said the negotiated rates were just too low. 40% said the carrier was just unwilling to negotiate with them or even interact with them. And 28% said they just weren't offered any type of opportunity to negotiate with a carrier. What this is resulting in is more and more of these freestanding ERs are not in network with your carrier, and therefore they are likely going to be the most expensive because the facility and the physicians will be out of network. So I hope you found this beneficial. There's 5 different options to consider when you need emergency care. And emergency care is something that is defined by you and not necessarily that physician. And I hope that these options are something you think about when you need it in the future. If you're looking for a health insurance agent that's going to help you think through these, be there when you need medical planning and support with your bills, contact me. My name is Steve Stump with U.S. Benefit Advisors. Thanks and have a great day.